Hi, my name is Caitlin Crooney. I am the occupational therapy student that will be working with you today. Today we are going to go over how to perform active range of motion and self range of motion for the shoulder, elbow, forearm, wrist, hand, and fingers. Active range of motion is when you are able to make the movement happen on your own voluntarily. Self range of motion is when you use one of your unaffected hand on your affected side to help make the motion happen. I'm going to go over some precautions, which include using the proper range of motion technique. Make sure the movement is smooth and you avoid jerky and bouncing movements. Do not force a movement that is out and past your level of comfort. Stretch in a slow and relaxed way. Do not overextend joints, which is straightening. And make sure that you are breathing normally and don't hold your breath. Contraindications, which are reasons for why you would not do these exercises, are if that area is healing from a fracture, if it's healing from surgery, if that area has experienced severe and recent soft tissue trauma, and if you have any cardiopulmonary dysfunctions. Now we are going to go over active range of motion for the shoulder. So your thumb needs to be up, and you are going to bring your hand up to the ceiling. Hold for 5 to 10 seconds for all active range of motion exercises. With your thumb facing out in front of you, extend your arm back. Then you're going to bring your arm, face your thumb away from you, and bring your arm up to the side. When you come back down, change the direction of your thumb and bring your arm across your body. Then, with your thumb facing the ceiling, bring your arm in front of you and bring it across your midline and away from your midline. Next, you're going to bring your elbow up like this, like you're flexing your bicep, and you're going to face your palm towards the ground and face your palm up towards the ceiling. Those are the active range of motion at the shoulder. For self range of motion at the shoulder, you are going to place your affected side, which is my right side, on top of the non-affected side. Interlock your fingers and place them in between your knees or in your lap, and you're going to use your unaffected side to lift your affected side up above your head and back down. The next exercise, you are going to again use your unaffected hand to grab the wrist of your affected hand, and you are going to bring your arm across your body and then push your arm out like so. And the next one, you can use a towel. You're going to bring it behind your body, bring your hand in the small of your back with your palm facing the towel. You're going to pull the towel down, and then with your top arm, pull up. The last self range of motion, you're going to have your elbows at your side. The unaffected arm is going to grab the wrist of the affected side. You're going to bring it across your body, keeping your elbow at your waist, and bring it out. Next is active range of motion at the elbow. You can place your elbow on the table, have your thumb facing you, and you are going to put your arm down on the table and bring your arm up and touch your shoulder with your thumb. Self range of motion for the elbow is performed by bringing your unaffected hand and interlocking it with the fingers of your affected side. Place your hands in your lap, and by bending your elbows, bring your hands up to below your chin. After you bring your hands up to your chin, you will straighten out your elbows and bring your hands back into your lap. The next active range of motion exercises that we'll be going over is involving your forearm. So with your elbow placed at your side, you're going to start with your thumb facing the ceiling and flip your palm up so it's facing the ceiling, and then flip your palm down so it's facing the ground. For self range of motion, for this movement, you are going to get your unaffected side, interlock your fingers, and by moving your unaffected side, you can replicate that same motion that we just did. For wrist active range of motion, you will rest your arm on the table so that your wrist is hanging off, and you will point your fingers to the ground, point your fingers up to the ceiling. You can do wrist circles, making sure to not move your elbow and just the movement is coming from your wrist, and switch directions. By placing your hand on the table, keeping your fingers together, you want to bring your fingers so that they are trying to touch the side of your arm, and then go the other direction, trying to bring your pinky to touch the side of your arm. Self range of motion at the wrist, you will bring your unaffected hand and interlock your fingers, and by moving your unaffected side, you will bring the palm of your right hand up to the ceiling, palm of your right hand down to the ground. Then you can make your unaffected hand like this and bring it over your wrist, and you're going to keep all your fingers together and bring your hand so that it's trying to touch, your pinky fingers trying to touch your forearm, and then you bring your hand so that it's pushing your right hand so your fingers are coming towards your body. You can stabilize down onto the table. Last, we will be doing finger and thumb active range of motion. So you want to use your finger of your unaffected side to block below the first set of creases on your fingers and bend just your fingertips down. And then move below the second line of creases and bend your fingers down. Then move your finger below these joints, but on your palm side, so that your fingers can bend all the way down and touch the palm of your hand. You can move your thumb to touch each fingertip, and that's active range of motion of the fingers. For active range of motion of the fingers, I also wanted to add that when you were in this position where your fingertips are touching your finger, you want to also make sure you are straightening them out back to the table. So make sure you focus on straightening them out back to the table for each of the movements that we talked about. For self range of motion of the fingers, you are going to use your unaffected hand to bend, starting from the fingertips down, and then from the next knuckle down, so that you are making a fist with your hand. And then you will unbend, starting from the joint closest to you, so just your fingertips are bent, and then extend your fingertips out. For thumb self range of motion, you are going to hold your pinky and your thumb and bring the fingertips together. Ring finger and thumb, bring the fingers together. And then using your thumb and your index finger of your unaffected side, you will place it in between your thumb and your index finger and push the thumb out. Some activities that you may be doing throughout your day that use these motions in your fingers, wrist, elbow, forearm, and shoulder include folding laundry and putting laundry away, putting dishes away or cleaning dishes in the sink and then putting them away, washing your hair, brushing your teeth, brushing your hair are all some of the activities that you need these motions in order to independently and easily do these activities.